The Pacific Dental Services Foundation has spent the last few years focused on special needs advocacy and training because they know there are many barriers for patients with special needs. They have recently opened a brand new special needs clinic. This new dental practice provides high-quality dentistry to pediatric and adult patients with special needs. The clinic has specially trained dentists and team members equipped with behavioral and environmental techniques to ensure successful dental visits. We're thrilled to have Dr. Jacob Dent, one of the practicing dentists, and Kyle Guerin, Director of PDS Foundation and Corporate Social Responsibility for Pacific Dental Services. Gentlemen, welcome to the Group Dentistry Now show. So tell us about the need for special needs dentistry in America.
So right now in the United States, there's this growing epidemic for special needs dentistry, and it's just revolving around the fact that right now there's about 52 million plus people in this country with a disability, that being physical or intellectual disabilities. With the 126,000 dentists in America, there's only about 10% of those dentists who are even willing to see patients with special needs. So the math just doesn't work out. 52 million for 12,000 dentists. There's not enough, there's too much demand and not enough abilities to see everybody.
And why do you think dentists are so reluctant to treat patients with special needs?
Well, there's a couple of things. First, there's a lack of training that comes in dental schools. More and more schools now are starting to see the need and incorporating programs, but you know, when I came out of school 16 years ago, it wasn't even suggested to be part of the program. You know, it was referred to a specialist. And so for the general practitioner, there's nothing out there, in our curriculum that taught us how to do it. So it either you decided you want to learn or you just didn't do it.
Right. So we have dental schools who are listeners and subscribers. And I was just wondering if you have any plans to bring on dental schools for training or dentists for training to learn how to, provide access to care for special needs patients.
Of course. When we look at our office in Phoenix area, we're committed to kind of an open door policy for any of the dental students, the residents, anybody that wants to see what special needs dentistry really looks like in the real world. Even in my office in Houston, we're working with the dental schools there to allow access to anybody who wants to come and learn.
Well, that's great. Kyle, why did they choose Phoenix as a location for this special needs clinic? And do you have plans to expand to other parts of the country?
Yeah, there were a couple of reasons that Phoenix was considered. One is one of our PDS Foundation board members is Dr. Jack Dillenberg with A.T. Still University, and they are one of the leading schools in allowing their residents and seeing individuals with special needs in those patients. So they had a clinic on the side of town that had been just hadn't made it. So it was an opportunity to have some resources, to have some knowledge. And then it's the payer mix. It's the opportunity to, use access and take the insurance plans, as well as the ease of allowing dentists from out of state to get a temporary service license within Arizona to be able to, as Dr. Dent said, this one clinic is not going to solve the problem, but we're hoping that it's the beginning of something where dentists and students can come, they can train, they can learn, they can see. And really, this is a pilot program. We have to prove that it's sustainable, that we can keep the doors open, we can keep the lights on, and if we're successful and we can, make this sustainable, the sky's the limit to see where those next clinics could possibly be.
So if we could just shift gears a little bit, I on our website, we featured a video, PDS Foundation produced it, and it shows a patient named Benjamin getting access to care there at your clinic. And it was just a really heartwarming video. And it was a lot of sensory integration, things you have going on there. Can you talk a little bit about that in your clinic?
Yeah, so we had to design an office and an environment that adapted to the needs of the patient instead of trying to get the patient to adapt to a traditional dental practice. So we created a sensory room that basically just became a non-threatening, just a fun place to be. And so that allows the patients to just take an opportunity and say, this is a pretty fun place. It lowers their anxiety levels. But for the parents too, and the caregivers, the anxieties that you have as a parent going to any dentist or doctor are overwhelming because you just, in the back of your mind, you think this isn't going to go well. And so in Benjamin's story, he was the typical patient that we see where parents were just struggling to find somebody that would even be willing to see them. Because a lot of times the parents report when they call and say, I have a special needs child, or I have an adult child that I'm taking care of. They just immediately say, no, we can't see them and don't even let them in the front door. So Ben was a great opportunity to see, because prior to us, he hadn't been to the dentist in a while. Mm-hmm. And now he's, I see him every 3 months. He comes in, family's good, and he's getting really used to the routine to a point where, he knows where he's at, and it's no longer a threatening or a hard thing for him to do.
Well, it was amazing. You wrapped him in, I think it's called, is it a Joey blanket? Is that what it's called?
So in the video with Ben, it's called a Joey board. It's just it's a protective stabilization board that we use. But it's just 2 pieces of Velcro. That's it. We don't, the thought is, this is going to end up being leather straps in a white padded room when people think of stabilization, but it is literally just 2 pieces of Velcro.
Well, as soon as you wrapped him in that, his face just lit up with a huge smile. It was clearly exactly what he needed to calm any anxiety that he was feeling. So it obviously works, what you're doing there. So besides the special needs clinic, what else is the PDS Foundation doing to help people with special needs?
It's interesting. This really started a number of years ago, and it started with Dr. Dent and his just desire of moving this population. And it started with education and training. And so we went around in a number of events and did probably, I think we trained around 1,500 people over this time, and it's been great. And the goal was, it was successful, but I don't think we were moving the needle quite as much as probably the foundation like. Obviously, not as fast as Dr. Dent probably would like. And so the clinic has become kind of the epicenter of this movement, and so the education's still there. We want to take and just see what is possible. We want to make it that this doesn't have to be, Dr. Dent's an amazing clinician, but he doesn't have any like Jedi mind tricks, or he doesn't, maybe he does. I haven't seen it, but it's possible, but it's teaching confidence, and it's just teaching patience, and it's teaching compassion. And so we want to continue with the education, but really it starts kind of in the special needs clinic in Arizona. And we're hoping that as we get people, we're in talks, there's a number of residency programs that want to come in and want to move forward. And we're moving a little slow because we want to make sure we have our home in order and all the just kinks ironed out. And, but there's so much opportunity there beyond just Arizona.
Well, speaking of opportunity, Dr. Dent, you work with the Special Olympics. Do you plan on developing a relationship with them and the clinic?
We've already done that. We see a lot of the athletes in Arizona right now. And, being the clinical director for Texas and Louisiana myself, that was one of the other things that I saw a huge need for. Is Special Olympics is a wonderful organization, and they do a lot of great things. But from our Healthy Athletes program, we would go in, do a screening, and identify patients that had a need. But it always came back to the same point. So who do we go to that will actually do the work? And it was very disheartening for me to go, I'm sorry, I don't know. And dental schools themselves have always been kind of the fallback for special needs. However, I can speak for Texas. Out of the 3 dental schools there, there was over a year waiting list to even get into the dental school for a special needs patient. And if you were a patient, it was almost a year between appointments. So they were inundated with that. So again, my office in Houston has kind of become even their referral source because it's not just the kids. And I think that's the big point that we try to make is, kids are cute. Everybody wants to see them, and they're a little easier to manage. Nobody wants to see the 6 foot, 200 pound, adult who is, let's just say, non-compliant with just sitting in a chair and open and wide. So what I try to do and teaching and obviously showing by example is, it takes clinical skill to do dentistry, and everybody who comes out of school has clinical skill, but it takes more of the emotional abilities and the patience to be able to say, okay, I've got to connect with these people. I've got to give them time, which is really the most crucial part of this. Is you got to give them the time necessary, and then really be able to empathize with not only them but their caregivers, because a lot of times parents or nurses or therapists, whoever comes in, they're just looking for a little glimmer of hope that there's improvement that can be made here.
Well, it takes a really special person, and you're a really special person. Why is this so important to you personally?
Well, in my own story, I have a 15-year-old son, Ethan, who was diagnosed at age 3 with autism. And so, as I've been going through this day in, day out residency myself of being a dad of a special needs child, I saw the struggles that I went through. And it's kind of that nature of, if I'm struggling with things as a doctor and as a dad, what is the layperson doing? And so what I did is I just took everything that I learned from all of the years of therapy and all of the struggles that we did, and we just applied it to dentistry. And it is a complete out of the box way of looking at things and doing things. And it kind of violates every time and money factor that most dentists look at. And that's another concern that we all face is, until there's some changes that are going to happen with actually reimbursing dentists for the extra time it takes to do this right, nobody's going to be really willing to do it. It's just because, why would dentists who have all of this debt, have all of this, especially student loans now are ridiculous, come out of school and say, I'm willing to see a special needs patient. It may take me an hour, or I can see 3 neurotypical patients in the same hour and make 3 times as much. Which one do you think they're going to pick? Mm-hmm. Especially if they don't have any training from school in that. So there's a lack of confidence. There's a monetary portion. And most of them just, again, don't have a personal connection.
Well, the PDS Foundation is obviously in a unique position right now to help people. And it's really incredible what you're doing. What other plans do you have in the future, Kyle?
I just wanted to just go back to one of the exciting things that we're doing with Special Olympics is kind of on 2 levels, and it ties both of the for-profit side, Pacific Dental Services, who recently just became a sponsor of Special Olympics International. So we sponsor the Special Smiles program, and that really has allowed us to open the doors for more of our supported clinicians to just get a tiny taste of what this is like, doing more screening events. So with the Pacific Dental Services Foundation also has a mobile dental clinic. It's a 2-chair CEREC, all digital. I mean, it's beautiful, but we're traveling to more of the Special Olympics Summer Games and trying to do more of the treatment. Now treatment on site there will be in San Antonio upcoming, and so half of our events on our tour are going to be at Special Olympics events. So the hope is that the more we can just, expose these clinicians to these different events to get that once we serve and we volunteer, you get that bug and you get that excitement. And what's been cool is, as Dr. Dent said, is he's the local clinical director in Houston, Louisiana. We're hoping we have somebody who's interested in taking that position in Arizona. And then we're looking at other states to really serve and take that next step. So, with the PDS Foundation, we continue to, we serve internationally, where we have our own dental clinic in Guatemala, where we continue to do more trips, partnering with dental schools internationally. And we hope there even we can begin to see some of those special needs patients that are really getting, they'll have the lack of access to care internationally. So between our international trips, we do dental assistant scholarships for individuals interested in getting a career in dental assisting, to our, obviously our special needs clinic. It's an exciting time with the PDS Foundation.
It really is. And you're in a great position to help so many people. And just to touch back on the clinic a little bit, Dr. Dent, I noticed that in your clinic, you're not always treating patients in the traditional way in a chair. Can you talk a little bit about that, on how you have to really change your training and methods to best serve your patients?
Yeah, it's like I said, it's an outside the box way of thinking. So if you try to adapt the patient to your environment, go sit in a chair, be still and let me do my work, it's not going to happen, and so we've kind of designed the offices around the possibility of every objection. And so again, how we do it, we start in a sensory room, and that's really where it comes to the patient sits, enjoys their time, but that's where we talk about home care, and we work with the parents. So for me, my first visit with a child or an adult child that's still at home is we let the parents be the dentist the first visit. Mm-hmm. So if they're brushed in front of the bathroom sink, we brush in front of the bathroom sink. We do have patients that have a phobia of getting in the chair. And so we created a room that is actually designed with no chair. It just has a bean bag and a little foam rug on the floor. And so they'll go sit on that, they'll play on that, and we'll brush their teeth just sitting on the floor. So pretty much anywhere that they will get, we will find them and we'll take care of what they need. So it's making them more comfortable. It's really more about being patient-centric than it is about making it easier for myself as the dentist. So it's not always ergonomic. It's not definitely it's not easy. That we do have patients that, for example, can't get out of their wheelchair. And then we still treat them, regardless. And so it's one of those, we go where they are. And we get it done. Truly
patient-centric care. Kyle, do you have anything to add about the PDS Foundation and anything else that you'd like to discuss about your foundation?
Yeah, it's just, it's been incredible. I mean, and the carryover that this Dr. Dent, I ran into somebody the other day that works at the support center in Irvine for Pacific Dental Services. And she has a special needs sister. And we were talking about her dental care, and we're talking about the situation, and we're talking, well, she struggled because she can't get out of this wheelchair, and it takes us so much. And just from what I've seen with Dr., I was like, well, what about the wheelchairs that tilt back? She's like, I never thought of that. And so then she was able to go in and she was able to get one of those wheelchairs. And now, it made it easier for her to just go see her normal GP dentist who sees and takes care of her care. Hers was a little different because it was more physical, and the transition to, but it's like when we all can put our heads together and problem solve and be willing to do, again, this patient-centric care, it's incredible the impact we can have on the lives. And I think, with the PDS Foundation, we're thankful for all of our donors and it's so great to see all these people coming together. And it's cool to see the impact that, with things that maybe Pacific Dental Services and the foundation's doing that inspires other DSOs to do international trips, or to get other mobile clinics, or to see private practice dentists that get this idea of service. And we just want to be kind of that catalyst and that just igniter of this idea of service. And that's what we're trying to do.
Absolutely. You're trailblazers. And I know you said it's a pilot program, so it will be really interesting to see where you take it. There's obviously a huge need for this special needs dentistry, and what you're doing is absolutely amazing. So I'd really like to thank Dr. Jacob Dent, Kyle Guerin, for joining us today on the Group Dentistry Now show. I've learned a lot, and I'm sure our audience has as well. Thank you.
Thank you.
Thanks so much.
The Pacific Dental Services Foundation Dentists for Special Needs is located at 4550 East Bell Road, Suite 106, Phoenix, Arizona. For more information or an appointment, please call 602-344-9530 or email care@dentistsforspecialneeds.com or visit their website at dentistsforspecialneeds.com. Thank you for joining us today. The Group Dentistry Now show has listeners across the United States, Australia, Europe, South America, and Japan. If you like our show, tell a friend or a colleague.